Looking ahead, tomorrow marks 3 years since we had our first case of COVID-19 here in Ohio.
And although it feels so much has changed for all of us, for nurses on the front lines, the memory of those early days are still raw. So tonight, only 10 TV's Lindsay Mills was allowed inside one intensive care unit that saw some of the first and worst cases.
We were all just like, oh my gosh, I cannot believe this is happening.
Registered nurse Amy Peach was working in the medical intensive care unit at OSU Wexner Medical Center when she learned the news. It was March 9th, 2020.
We were the first unit to take care of COVID patients.
She says in the months that followed, there were moments that were stressful and intense.
There was a couple weeks where I had like a death every shift.
She had never dealt with so much death.
This was where you'd have your whole section. There would be like 3 or 4 in a shift. You come back the next day and, no one, the different people are there.
And in many cases, she was the only person with a patient as they passed away, holding an iPad for family to virtually say goodbye. But things out of her control made matters even worse.
If the iPad wasn't working fast enough or quickly, you just felt like it was your fault.
And at times, she personally knew her patients.
When it's a good friend's like mother, it seems a little bit different.
The weight of what Amy experienced was unfortunately shared by so many others.
Tell me about that moment when that picture was taken.
So that was a moment where it was all hands on deck.
Abby Evans is a nurse administrator at 2 Ohio Health Hospitals. In her role, she oversees her team, but at times, COVID changed that.
I had to garb up. I had to help transport a patient. I shared those feelings of the unknown, of the fear. I just really had to, in the moment, do what I was called to do as a nurse and just trust that everything would be okay.
Their stories are ones of perseverance and proving they can overcome anything.
We are better nurses by what we saw and by what we cared for, and it has helped advance the practice of nursing.
And it united nursing teams closer than they were before.
You're in it with so many people, your coworkers, so you just don't feel like alone.